Fear can keep you alive, but it can also keep you from living and enjoying life. Throughout medical school, I studied a lot of different conditions, and I started getting afraid as I'm reading about things, wondering, do I have that kind of cancer or that kind of cancer? I probably became seriously concerned that I had like 12 different types of cancer over the course of my medical education, and since. I have to watch out about giving into fear, same as anybody else. Sometimes the fear can become so intense that it turns into a diagnosable mental condition, and there are three that are worth talking about. The last one is the most devastating of all. The first condition is called somatic symptom disorder. A lot of us have some pain in our bodies. For example, right now, my lower back hurts. My left arm kind of hurts. I have a little bit of a headache. My throat's a little bit sore. My left knee's hurting a little bit. I have some sort of nausea in my stomach. In reality, most of us have things like this most of the time, especially as we get older. It's kind of like the pain that we just sort of ignore. Thinking about it, I have kind of like a burning sensation on my back as well, and my left thumb hurts. So in the case of somatic symptom disorder, you do have actual symptoms. You are experiencing something, but you have excessive thoughts about it. Most of us are just kind of able to say, yeah, my body kind of hurts in a few places, whatever, I'll get past it. I drooled last night, or I have a kind of a headache, or I have a ringing in my ear, or, there's something in my left eye, or whatever. But when you have somatic symptom disorder, you get super focused on it and super messed up by these symptoms. It dominates your life. You're constantly going to the doctor, Googling everything that could possibly be related to this because you're freaked out by it. And this is present for 6 months or more. The next condition is called illness anxiety disorder. In this condition, you may not have any symptoms. You might have some symptoms, but that's not really the focus of it. In this one, you're just really worried about getting a certain disorder or disease. So for example, let's say that your grandpa just died of cancer, and you're like, oh my gosh, cancer is freaky, and now you're constantly worried about cancer. Can you check to see if I have cancer again? I need an MRI of my brain. I need an MRI of my stomach. I need this test. I need that test. You're worried about getting cancer all the time. You have illness anxiety disorder. You're worried about getting some illness with or without any symptoms of it. It becomes obsessive. You're worrying about it all the time. You're constantly Googling or requesting things be tested to see if you have it. In both somatic symptom disorder and illness anxiety disorder, you probably have some insight that you're worrying about this too much, but it's really hard to control that worry. This brings us to the last and worst of all, which is delusional disorder, somatic type. This is the life destroyer. This is the family crusher. These people have terrible insight. They know that they have the condition, and nothing that anyone says can change their mind on it. 1,000,000 doctors can run 1,000,000 tests on them, would make no difference. They still know that they have it. They're delusional. They have a fixed belief. Everyone else starts saying, like, look, I don't think you have this. People are like, I think you're delusional, and they just start shoving everybody away. They don't care. They get really emotional and really angry if anyone challenges that they have this disease or this condition. The most common way that I see this is people thinking that they're infested with some kind of parasite or a fungus. Do all kinds of scans, do all kinds of tests, all kinds of labs, all kinds of evaluations, and all the doctors are saying, look, you don't have this, we've tested for this, we've looked into this, we've done everything we could, you don't have this. And they say, yes, I do. They get really, really upset. They're completely obsessed over it. Sometimes they get so obsessed they start even diagnosing these things in their children. And they'll start saying, my children have parasites, or my children have this. And it starts becoming dangerous because they start either doing things to their kids or requesting things to be done to their kids that can be dangerous. And there's instances where government steps in and takes the kids away. And I've seen this happen. All of these three conditions are disorders, mental disorders, that can ruin your life. Of the three, the last is the most dangerous because it ruins your life the most, and people are really resistant to any sort of treatment. Even talking about treatment, they're resistant to that. The thing is that all of us have this to some degree or another. All of us, for the most part, worry about getting sick. We worry about getting some sort of illness. We worry about our symptoms. But there's a point where this worry can become pathological. Watch yourself that this doesn't happen to you. This is something I see often and work with often in patients. If you know that you're right, and all of the doctors say that you're wrong, you're probably suffering from this condition. And yes, the human brain can do this. I've had many patients who outright hallucinate their entire reality. The human brain can do just about anything. So don't think it's impossible, because I'm sorry, you're delusional and anything is possible. And if you think it's not possible, that's actually evidence that you're delusional, because one of the things that I found is a hallmark of all delusional people is that they're sure, absolutely sure, that they're not delusional. Whereas any ordinary person would wonder, person without a delusional disorder, if every doctor came to them and said something, they'd be like, maybe I'm delusional. They start wondering about it. I think I might be delusional. I'm really concerned that I'm delusional. But delusional people, not even a consideration. They know that they're not delusional, and that's a sign of being delusional. What happens is that people that love them start to step in and try to have conversations with them about their concerns, saying, look, I'm worried that this isn't happening. Where did you get your kids taken away? I'm worried that these bad things are happening. And they get angry at their family members for not believing them. They feel like everybody's against them. But in reality, these are people that love them more than anybody else. And they're trying to have conversations with them and express concern. So they push all of those people away. And then people that love them are really worried to talk to them about their concerns. And so some of the people that stay are the ones that just sort of pretend like they agree with them, but they don't really. And so everybody around them is sort of walking on eggshells and worried that they can't talk to this person about what's going on, because the person will get really angry and really upset or really hurt or start crying or yelling or something like this. So try to have some insight, look into this. This is something I run into frequently in my practice, and it's something that all of us need to look out for. Good luck.